You mentioned that there may be 72 ways to do a restoration, for example, but there's no evidence to say what's the best for that patient, that unique patient in front of you. And when I absorbed that from you, I really started to go with my gut instinct. I became better at just being a bit more decisive rather than really pondering every small nuances, which really probably wouldn't make that big of a difference. So if you just expand briefly on that.
So there's actually two parts to why you found it easier, and one of them is communication. So if you are ever unsure what to do with a patient, you haven't asked the patient enough questions. Like if you're sitting there going, I could do endo, but I could do an implant, but I could do endo, but then, what if the endo doesn't work and then I have to do an implant? Well, ask the patient. It's very simple. You say, look, I think and as dentists, because we're not well trained, so dentists are not well trained, this is not a criticism of universities, they just don't have enough time. To train a dentist well will take about 12 years, okay? And it would take as long as ophthalmology, because what we do is about as hard as ophthalmology. We're a surgical specialist who is trained for as long as a general medical practitioner. Actually, less long than that. So there is a reason why you don't feel competent when you graduate. It's because you haven't been trained for long enough. So we don't have confidence as dentists for the early part of our career, and often we keep that up for a lot of our career to actually tell the patient what's best, because we get so trained in, have to let the patient... We actually can't let the patient make the decision of what's the ideal treatment for them. We can let them be involved in the decision. They can guide us to what they want to achieve, and they can say no. But if you have a patient who's got a tiny incisal corner off, and then you offer them all the available options, including an extraction, and they say, well, just pull the tooth out, okay? You can't, there is nowhere in the world it's defensible to say, well, I offer the patient all the options for their small distal incisal chip on their 2-1, and they chose to have their front tooth extracted. So the idea, first of all, that you gave the patient all available options is not true. You never give the patient all available options. Secondly, the idea that you are removed from your responsibility in any way by what the patient chooses is also not true. So if you go to a surgical specialist for, say, a sore knee, and he looks at your knee and determines that you need an arthroscopy, okay, to do something or other, he doesn't give you 19 options. He gives you 2, which is do the arthroscopy or don't do the arthroscopy. Okay, and so that's most of the time in dentistry, we give people too many options, and it's because we haven't listened. So now, the problem with the word evidence-based dentistry or evidence-based medicine is that people forget what it is. So, and it would be better to be called knowledge-based dentistry, because mostly there is not a study or a group of studies that directly relate to this patient. So you're taking your knowledge. So if you've read a lot of literature, you're taking that knowledge, but it doesn't ever directly, or almost never directly, apply to that particular patient that's in front of you. So when Guyot and Sackett wrote the paper on evidence-based medicine, it was using the best available evidence and combining it with the patient's wishes and with your clinical experience. Okay, 1/3 process of evidence-based medicine is the best available literature. 2/3 of evidence-based medicine is the patient and the practitioner. It's not 99% is the best available literature and 1% is the patient and the practitioner. That's absolutely not true, and it is a misrepresentation of evidence-based. And the word evidence is often used to argue with people without actually any support. So if you want to argue with someone, or like if someone says something and you don't want to believe them, you just go, show me the evidence. So, it's mostly a debating tactic. But what you can always do is spend more time listening to the patient. So, and helping them understand the consequences. So what I like to do in my practice is very simple. It's, work out what the patient has, work out what they want, and find a way to get from what they have to what they want at a price they can afford.
Wow, that's dentistry.
Without long-term regrets. You always got to have that bit in there. Took me a long time to work that bit out without long-term regret.
Hey, if you enjoyed this snippet from the Protrusive Dental Podcast, be sure to check out the full episode on www.protrusive.co.uk. It's also available on Apple Podcasts, Google Podcasts, Spotify, Amazon, you name it. It's everywhere. Also on YouTube. So check out the content. If you like it, please share it with a friend. Thank you.